So coming to the scrotum examinations. So after completing the groin regions, so again we have to explain, okay, I'm going to do the scrotal examinations and also testicles. Now ensure that so there is no swelling, the presence of the hard or tender nodules. So I'm going to check for the any lump or any nodules. So I will roll my finger gently so that you will not experience any pain. So we have to explain, I'm going to roll my finger pads on your scrotum. So if you feel any pain or any swelling, so or if you discomfort, so please let me know. So according to your response, I'm going to do my physical, like I'm going to continue the examinations. So I'm going to do simultaneously instruct you performing the testicular self-examinations, which I recommend that you perform once a month. So along with we have to examine as well as we have to give the instructions how to do the self-examination, testicular self-examinations. So if you explain clearly before performing the scrotal examinations, so the patient also can get some doubts about so how to perform and also how he got before any complication related to the scrotal pain or tenderness or maybe any lumps in the scrotum. He is going to reveal and also is going to give the complete information. So here in the scrotal examinations, so ask the patient, so lift the penis out away. So that's when if they lift the penis, so we can allow to close inspect the scrotum and also perineum for any relevant clinical signs. So in this one, if they lift the skull like a penis is against to that means a lift away from the scrotum, so we can find out any changes in the scrotal region, any skin changes such as like any warts or any fungal infections we are going to find. For example, in case of any like a papilloma virus. So if any papilloma virus means they may chance to get the warts. So this is the scrotal warts. So is most genital warts, most commonly seen who are having the like a this papilloma virus infections. So we can identify. So if any warts are present, so we can suspect the person having the papilloma virus. Or we can maybe any skin changes is because of any fungal infections. So because of these folding areas, so between the inner thigh as well as these scrotal regions. So because of these foldings, because of the sweat or moisture, so may chance to develop the fungal infections, most common in the male. So it is because of these infections, so it may give so many like a fungal infections such as like a candida or maybe is the tinea cruris, or so many different type of the infections may chance to get in the scrotal regions. So that's the reasons we have to check and also inspect the scrotal region clearly. And also in case of any scar formations, so we have to found any scar formations. So this scar formation reveal previously undergone for any surgical procedures such as any vasectomy or any testicular fixations. So vasectomy means to control like in the after the like to control in the male there's a spermatogenesis or and also in case of like a uh, to prevent like a control the births. So with the vasectomy they ligate and also do the surgical procedures. So those people may not get the like a sperms. So it may gives the like may controls the birth. So that is any surgical procedures we have to identify any surgical procedures are such as the vasectomy. And also in case of testicular fixations. Testicular fixation means sometimes in the congenital abnormalities, the testis may not come into the scrotal regions, sometimes may undescends. So it may be in the abdominal regions or else maybe in the groin regions. So in those conditions, if any surgical procedures, so they are going to bring the testis into the scrotal regions. So if any congenital abnormalities. So in that's the reasons we have to identify any like a scar formations. And also next one is we have to identify any masses, so any lumps. So note any lumps associated with the scrotum. So especially in the testicular cancers and also in the perineal region, any lump or any masses or any abscess formation, any pus formations because of the bacterial infections. So or any inguinal lymph node enlargements. So we have to know is there any infections or maybe cancers. So because of any mass development. So these things we have to identify during the scrotal examination. And also other things we have to identify. So and also any swellings. So these swellings are not any swelling on the scrotum. So in case of the hydrocele. So hydrocele, that is nothing but is the accumulation of the water is surrounding to the like a testis. So this may leads to the edema and swellings. And also we have to check for any erythema in case of cellulitis. In the cellulitis, so if you see here, so this a normal testis should be in the normal size. So both should be in the some slightly difference. But in case of hydrocele, so one testis is going to be enlarged. So because of the accumulation of the fluid surrounding the testicles, so it may use the enlargement and also swelling inside the testis. So we have to identify. So in those conditions, so if we identify the hydroceles, so what is the size of the hydrocele? So what is the causative factors of the hydrocele? So how is going to be the subside the fluid? So is then temporary, like through the medication, or in case of any abnormality, so they're going to be rectified through the surgical procedures. So that's the reasons we have to identify the size and shape of the testicles and also scrotal region. And also any bruising, so any abnormality in the scrotum, so because of any local trauma, any injury, any fall down, any objects hit on the testicles or scrotal regions may give the swellings. So we have to identify, is it because of the injury or because of the infection or because of the any accumulation of the water, is it because of the hydrocele? And also we have to check for any tenderness. So this tenderness may indicating the infective or inflammatory etiology. So if any inflammation is there, so any ependymoarthritis or any inflammation, so we have to if we have to find any tenderness or any swelling inside the testis. And also one of the severe complications, another one is the necrotic tissue in the scrotal regions. And also, so here is going to be the foreigners and also gangrenes. So this gangrene is going to be may chance to develop in the perineal region, in the genital regions. So that is the reasons we have to identify, and also we have to observe any gangrene is there or not. So this is going to be the necrotizing fasciitis of the external genitalia. So this fasciitis, so especially in the external genitalia, is going to be found in the perineal regions. So these are the one of the causative factors of the common originating from the infections of the anorectum and the urogenital tracts and skin of the genitalia. So this necrosis are because of the decreasing the blood circulations or because of the infections. So because of the infections may chance to get the necrosis. So especially the anorectal regions. So in the anorectal region and also urogenital tracts, or maybe is any skin of the genitalia also may chance to give this like a necrotizing fasciitis. So these are going to be causes is a more common in case of the perianal, perirectal, ischiorectal abscess formations. So in case of any abscess formation, any pus formation in the anorectal regions, and also in case of any anal fissures, so any like a infections, it may give the fissures or fistulas, or is a colonic perforations. So in these cases may chance to get the necrotizing of the genital regions. So we have to found is there any necrosis, or these are going to be, so these are the one of the causative factors, is the fissures, any abnormalities in the rectum, and also fistula, also any hole or any because of the infections, so it may affects the any shallow depression inside the rectum, so make use the infections. So this because of the abnormalities in the anorectal regions affects fistula and also fissures. So it may chance to get the infection frequently because of these is connected to the waste material passageways. So it may spread the infections to the genitalias also. So it will use the necrotizing fasciitis.